Over the last 12 years, I've seen a lot of patients that have pain in this area right here. Oftentimes these patients come in after having had neck surgery or even before neck surgery, and they're confused because they're not really sure what's going on in this area. So after many years of taking care of these patients, I figured out that oftentimes one of the culprits is the AC joint. I've seen it so often, and I've seen this pain pattern so often that I call it the sneaky AC joint. Now, why do I call it the sneaky AC joint? Because everybody thinks they have neck pain. They really don't have neck pain. The problem is right here. It's the AC joint. So I see this in people that do a lot of overhead activities, people that weight lift, or anybody that just moves their arms a lot, especially at work, and they do this all the time. They get a degeneration of their AC joint. It can also just happen from time. So how do you diagnose it? Well, first of all, this is the pain pattern. Patients will say, "Doc, this is where I hurt." They don't say this is where I hurt, and they don't say this is where I hurt, and they don't say this is where I hurt. They say this is where I hurt, right here. And on exam, all you need to do is take your index finger or your thumb and you give it a hard push. Give that AC joint a push, right there. Compare it to the other side, and oftentimes the moment you push, they'll say, "Ah," they'll do this. That is an AC joint that's most likely degenerative. The x-ray will show degeneration, and yes, it's a good idea to check the neck. It may not be a bad idea to do an MRI in the neck just to make sure, but remember, many people will have abnormal cervical spine MRIs even though that's not where the pain is coming from. So the easiest thing to do to figure out whether it's neck or the AC joint is put a little lidocaine in there. That's all you got to do. You ask your doctor, or you don't need to ask your doctor, but they will probably do it. Put a little lidocaine in that joint. I would just do lidocaine only, and the pain will most likely go away. I don't add steroid to it initially because if you add steroid, there is a systemic effect, and it might cloud the situation. So once again, the sneaky AC joint pain pattern here. Sometimes the pain even goes to the neck. Sometimes the pain even goes up actually all the way to the jaw. Physical examination, finger, push hard right here. And remember, the pain is not in this area because this is rotator cuff pain, this is biceps pain. Finger, ouch, x-rays, degeneration, lidocaine injection, that's how you confirm it. So what do you do about the treatment? I've had great success with physical therapy and PRP injection. PRP is platelet-rich plasma. If they don't want to have platelet-rich plasma and they just want to do something cheap and easy, you can put some steroid in there, but I always include physical therapy and a home exercise stretch program. The exercises are on my YouTube site on how to stretch your shoulder, but most importantly, I think what cures this problem is therapy, an injection, and an awareness that it's most likely not your neck, and they probably don't need a cervical spine fusion or decompression, and it's an easy way to start. So remember the sneaky AC joint. If you want to learn more about the sneaky AC joint, I actually wrote a blog article. You can just type in sneaky AC joint Dr. Mora and my blog article will come up. Okay, that's it from Orange County. This is Dr. Mora. If you want my web address, it's www.myorthodoc.com. Hopefully that helped you, and hopefully you can help some other people with this problem. Cheers.